Joost van Hoof ist Professor für urbanes Altern an der Fachhochschule Den Haag und Vorsitzender der Wissensplattform Monitor Age-Friendly The Hague. Sein Fachgebiet ist die Bewertung der Altersfreundlichkeit von Städten. Im Auftrag Den Haags evaluiert der Professor mit seinem Team die Zufriedenheit der Älteren und entwickelt daraus Verbesserungsvorschläge. Gemeinsam mit Partnern in Polen und Rumänien untersucht Van Hoof außerdem die Altersfreundlichkeit von Krakau, Breslau und Bukarest. Die wissenschaftliche Alterspolitikberatung hat einen Namen. Professor Joost van Hoof.
Well, what a crazy introduction that was. Not used to that, but it's good. Well, let me put it away safely. So yeah, well, the introduction did most of the work that I'm supposed to be doing, so that's good. One little hint right at the start, I'm also a full professor in Breslau, in Wrocław, in Poland, so that's the reason I come there quite often. So the project that I'll be touching upon is the project called City & Co, which is a European Union funded project with partners from Romania and Poland, where we explore the age friendliness of 4 cities. And we've already seen this model appear in German, which is good, but it's the original model that was published in 2007 by the WHO, divided into 3 clusters around municipal services, the physical environment, and the social environment, which also includes healthcare aspects. And we always call it the flower model, the flower with the petals, just like you have a little daisy. And you have these 8 domains that were already decided upon before the original publication in 2007 by the World Health Organization, when they published this booklet called Global Age-Friendly Cities, a Guide. This booklet is also available in many other languages, including Polish, but not in German, and I think is actually the reason why there's not much involvement. I need to talk this one. Or both. Both. Okay. Every day you learn something new. But this is the reason I think why there hasn't been a lot of interest in the last 15 years from Germany to sign up with the international network, to be honest. But a lot of other languages are available. And this booklet was a source of inspiration for many city administrators, but it also came with a checklist, which reads a bit like a menu in a restaurant. You can choose whatever you like and be inspired by the ingredients on this list. Then we have, actually it's 1,445 cities, communities, local and national governments that have signed up for this global network of age-friendly cities and communities, which was founded in the year 2010. 2010, so that's 13 years ago. And in my country, only Amsterdam and The Hague are members, no more than that. So we have a little bit of a, I would say, similarity with Germany. Like, people think it's important, but we haven't signed up for the network. But you can see that America, Chile in South America, Ireland, Slovenia, South Korea, Australia, and Spain are very active in this global network. If you happen to sign up for this network, I wouldn't say you get instructions, but you are encouraged to participate in this cycle, a 5-year cycle of age-friendly cities, during which you make plans on a municipal basis or on the city level. Then you also involve all the people, so that's what we do in The Hague. All the people are actually included in this policy making, albeit that I have to say that most of the work is actually done in the town hall. Then you start implementing the action programs that you come up with as a municipality. You start implementing these plans and you start defining the indicators for monitoring. And then after 5 years, ideally, you do an evaluation and the results of the evaluation are taken back to another round where you make new plans and so on. And I must say that the cycle in The Hague is somewhat shorter. It's either 2 years or 4 years for making these plans, but still we do the evaluation. And I can actually tell you a little secret, but I've been told by the WHO that most of the cities who are part of the network only make it to stage 1. So, The Hague. Well, some of you have been there. It's a very nice city. I always call it the better version of Amsterdam because we do have a beach. We do have a king and a queen. We do have nice canals, as you can see. We have the United Nations organizations like the International Court for Justice. So that also meant that we as a United Nations city, because we are the 4th most important United Nations city after New York and Geneva and Nairobi. So we are number 4, and then Vienna, number 5. But we had no other reason than to sign up for a WHO program, so we did. Right after we signed up in 2014, we became a member after New Year's Eve. Amsterdam joined as well, but we were first. And there's always this rivalry, of course. And one of the things that make us stand out as The Hague is that we do have this knowledge platform, and we build upon the foundations laid out by Gert's Urban Committee for Senior Citizens. And what we do as a knowledge platform is to assess and measure the 3rd stage of this WHO cycle, where we do the evaluation and the monitoring. And what we try to do is to create new knowledge that we can use for improving the action plans of the municipality in order to be and to become an age-friendly city. So one of the tools we have is this biannual monitoring, which was called Oudere Panel or Senior Panel, as Gert already told to you. And we do it in the even years, so 2020, 2022, so probably next year as well. And you can see this commission, right behind me, at least some of the people, but it's not all. And we have representations from our university, from other universities as well, from the older people, from the town hall, from welfare and healthcare organizations, the public health institutions. So it's quite a broad network, so to say. And what we also do is we publish on our findings. So everything we do is published in Dutch and English. It's open access, and even the stuff I'm going to present today is now officially available in English, but it can be shared through the Körber Stiftung, I guess. So it was 2020. I just started to work in The Hague, I think a year before. And then I got a phone call from the town hall, and I remember that one of the ladies was asking me, so how age-friendly is The Hague if you don't do it through interviews, but if you have real numbers? And I said, okay, good question. She was like, yeah, good question, and you're going to work on that, and you're going to get me these numbers. So I was like, okay. And I knew it was a bit troublesome. And then she said, you're an engineer by training. I do work in social work, but I'm actually an engineer. So you're the one who can fix it. No more questions. Get started. So we got a little grant, which was good. And of course, I have a team with me, and some of the people in my team have a background in nursing, but also in clinimetrics. So they were the ones who could help me out, and it's really a team effort, what I'm going to show you today. Because we have to be very realistic and very honest to one another. The WHO already admitted that in order to move the agenda forward, the age-friendly agenda forward, we had a problem, because we had a lack of measurability of the age-friendliness, because we hadn't got an instrument that could be used. And a lot of cities actually said, oh, forget about it, we're doing a couple of interviews and focus groups, and that's it. So, yeah, what could we do? And actually, the WHO already gave up, because in 2015 they had a nice publication on age-friendliness, and then they wrote, measuring the construct of age-friendliness is too complex. Well, sorry, but they gave up too early. And if you have this international organization, I simply cannot fathom, I cannot understand why you can't find the experts to do it for you. Like, Yeah, well, no more comment. And you know we're Dutch, so we're quite direct. So what a lot of cities did, they took this checklist that you saw on the first page, the menu, and they were just ticking boxes, and they said, okay, out of the 500 items, we ticked 80 items. And that was their way of doing quantitative research. And then, of course, as I said, we have a lot of qualitative methodologies like interviews, focus groups, making photos, discussing these photos, making documentaries even, unlike Körperstiftung, but then made by older people, like looking through a lens of aging. And it's all okay, but it doesn't give you the numbers. But some people tried to do it, but they came with an incomplete list. So what we said in The Hague, we need to have a good tool that can be used to measure age friendliness and all of its 8 aspects. It needs to be done in such a way that it's open access, so people can actually comment on it, give us feedback. We do it fully transparent. All the statistics, all the data is open source, so people can access it and recycle it for other countries. So that's what we did. And we came up with the Age-Friendly Cities and Communities questionnaire, which can actually measure age friendliness in its entirety. And a lot of people ask me, like, how did you do that? We use a certain protocol that's used in medical sciences to make measurement scales, like how do you measure pain in patients, or something really abstract. And you can use this protocol to measure such things, like psychological well-being is another thing that you can measure. So we did this through a protocol, and we came up with a questionnaire. I'm pretty sure it can be shared again through Körperstiftung to the guests today, but it's a 23-item questionnaire that can be answered on a so-called Likert scale, like do you agree or not, or are you in the middle, like a neutral answer. And it covers all the 8 domains. But what we found is that the domains were actually derived through an American data set from New York, and it's very American in its basis. So when we did this in Europe, with a different welfare system, with more social housing, well, you name it, you see, everybody knows the difference between Germany and America. You see that it is not a good fit sometimes. So we also found that there need to be questions about finance, like, do you have the money to live the life you want to live? Do you have the sufficient money to make ends meet? And if you have these questions, they actually rank really high in the factor analyses. So we added 2 additional questions on financial aspects of someone's life. So what you do, you get the scoring cards, and in the end we have numbers, but we also produce this traffic light, because people at the town hall, they think they like quantitative work, but they prefer color schemes. And it's not criticism, but this is how it works, because we have districts in our city. So it would be like Hamburg, Mitte, Altona, whatever, you have them here, but they actually start battling because we have aldermen or ministers on a municipal level, and they all have their own district. So they look at the scores and they think, oh, my score is not as good as someone else's. It can actually be quite stimulating to do something about it. And Gert already said that some of the changes in policy have been made through his efforts. We will see the same later. So we have this scoring card. Well, I said we also did the analysis in 2020, and then in 2022. Don't be afraid, there's a lot of numbers that we have to crack. But again, I want to show some highlights, because we had COVID, of course. And what we saw in these 2 years of COVID agony for a lot of people, we saw that the social participation plummeted in our city, because a lot of the older people didn't dare to go out to activity centers, to these meeting places, didn't go out for a coffee or a beer with one another. So these scores plummeted, and at the same time we saw that the results of social inclusion went up, probably because of media representation, which was really positive towards older people, more geared towards older people. And we also believe that a lot of people were no longer exposed to age discrimination as much, as they didn't go out. Then the outdoor spaces were another problem area. I heard Gert say something about toppling over on uneven pathways. The municipality already started investing, but the scores went down. So I think they need to invest more, to be honest, and they probably will, because I look at the coalition agreement that they have for the town, and there's quite a large investment program. And then we have the problem with finance. It's a bit of a mixed situation that we see, but we see that the polarization or segregation in our societies is growing apart in between the people who do have money and the people who don't have money. And the gap is getting bigger and bigger and bigger. And people who do have money become even more satisfied with the money they have, probably because they know that a lot of people have trouble paying the bills. So we also have these separate analysis of people who receive care and people living with one or more chronic conditions, and overall they are more satisfied with the health care that they get and with the services that are being offered, probably because they know what they're getting. But what I want to pick out again is his financial situation, because it's something that's so close to my heart. So people who are having the scores in red here means that they are actually not having the money to live a normal life, and their situation has deteriorated over time. Whereas the people who were rich, they significantly had a significant improvement of their view on the financial status. So we see a community that's slowly growing apart, which is not too much of a surprise, because The Hague is often called the most segregated city in our country. So, but it's not a good signal, or not a good sign for the national government. Should really do something about this. So in the end, we had all the data, and as you could see, it's thousands of numbers, and sometimes it's really puzzling. And if you talk to the city hall, they want to know, so nice to have all these numbers, but who are these people? Could you cluster them into groups? So yes, that's what we did. We came up with a clustering technique that I have used before in Australia during one of my research programs in a totally different field. But we found through statistical analysis that there are actually 4 separate groups in terms of age friendliness that you can define, so to say. And that's something I want to show you, because the moment we came up with the results of this study, we had a report from the Dutch federal government, and it says contemporary inequality. And it was the first report ever about a class system in the Netherlands. It's a bit like England in a way, but we are afraid to say we have classes in our society, but actually we do. And we had these clusters, and actually we had a one-to-one overlap with some of the classes that were defined by the national government. And what we saw here is, what you see here is the scores, but look at the colors. The colors are the most important. So dark green, very satisfied. Lower green, still satisfied, but not so much. The white is so-so, and anything pink or red is bad. And what we have is this huge group. It's cluster number 3. It's in the light green. It's what we call the average Dutchman. Positive, but so-so. Next to it is the rich group. So the people who are well off financially, they score really high in all these domains, probably because they do have the money to go out to a theater, to go out to have nice dinner, to travel, to spend time on whatever they like, have a nice house, etc. They can afford public transportation or private transportation. Then we have cluster 2. It's the group that we know have problems with their health. And they have problems reaching or venturing out, to go out of their house, to enjoy the public transportation, to go out on the streets, and to enter public buildings which are not so accessible. And then we have group cluster 1, which has problems with financial situations, and overall their scores are the lowest, because everything is impacted by the amount of money that you have. And I think that's quite a sad message, except for respect and social inclusion, because there the scores are quite even. But this is something that I always like to share with the politicians in our country. This is not about whether you're conservative or progressive, whether you're left or right, but this is something we should all be worried about, because we see this great unbalance in society, and our policymakers are not able to really deal with this. This is such a persistent phenomenon. That's the only activistic thing I'm going to say today. But what I worry about is that people in cluster 3, when they have a life event, like your spouse dies, you get less pension then, or you become ill. People from cluster number 3, and they look okay in the green, but they could become 1 or 2, like or poor or in bad health, with all the results there. Then a little zooming in on these, who are these 4 people? So we have a cluster that we call the precariat, which says something about the level of income, and it's likely to be females, and that's because of their early career that they had, or work-related aspects. So a lot of them were actually housewives, didn't have a job, didn't get a private pension, so they have financial problems because of that. And we also have quite an overrepresentation of migrants in this group. 1 out of 4 are likely to be born outside of the country. A lot of them live alone, a lot of them live in social housing, which is quite understandable, and quite a large number have a chronic disease, but still they rank their life 7 out of 10 in terms of quality of life. So overall the Dutch are quite moderate. They don't complain too much when things are bad. They don't think that life is particularly good when life is indeed good. And I can tell this because we also have these figures or these data from other countries. Then we have the people who are having mobility issues or are affected by disease. Again, more women, but then again, not really noticeable. But less or fewer migrants in this group. Again, lower education, but don't be surprised, many people in that of these generations have lower levels of education than the current society or the current younger generations. Again, no, not again. Lots of chronic disease, but there's more homeowners in this group, and that's quite peculiar because 40% of the people in the Netherlands have social housing. We have a very high number of people living in social housing. Then the average satisfied Dutchman, it's like a 50-50 ratio between males and females, but many of them are actually just born in the Netherlands. Home ownership is quite high. Not that many people who have chronic diseases, but still they do have chronic diseases, but nothing that hampers their mobility that much, only in 14%. And they rank their life, you're averagely satisfied 7.9 out of 10. So, but if you're rich, you give yourself an 8.4 out of 10. So you see, it's a small step to a large financial increase. And here again, it's a very wide group of Dutch people, lots of homeowners, and not as many chronic diseases. So it's another indication that if you're rich, you don't fall ill that quickly, I should say. I'm also keeping an eye on the time, don't worry. Yeah. So with the policies and the clusters, so what we do, first of all, we sit together with Nina, whom you just met, and we say we need to do something on the development of policy recommendations for each of these clusters through making non-stigmatizing personas, so like a little life story. And now we sort of realize that in the old days we had one senior Vriendelijk Den Haag, like the action program, it's the cover, but it was just like senior, so all the people, treat them as one group. But maybe we should look at more specific and dedicated solutions for specific clusters, because people are not a homogeneous group in society, and not all people need the same level of support. I think cluster 4 is not only representative bodies, but they should perhaps get less attention from policymakers, and we should divert actions to clusters 1 and 2, so the poor and the people with mobility issues, and then have more focus on clusters 3 and 4 in terms of prevention. So let them keep them on this higher level of functioning without running the risk. So with this knowledge, we were spreading out into Europe and beyond, and time-wise, I'm going okay. Yeah. So as we said, we have The Hague in the Netherlands, but we also do age-friendly work in, I will use the German words, Krakau, Breslau, and in Bukarest. And when we were doing this, we also had Krakau sign up as a member of the age-friendly global network. And they are actively using whatever we're doing there in terms of monitoring. But one of the goals was to take the questionnaire and make it suitable for use in Poland and Romania. And for me, that was just the first step. So a lot of these questions, we may think they are culturally sensitive or depend heavily on a political context. And therefore, these questionnaires are really hard to, I would say, transplant them like a kidney into someone else's body, but then into someone else's country, because some of the questions simply make no sense. So that is the process we went into, and at the same time we also developed another questionnaire on sustainable behaviors of older people, but I will not talk about that now, but it was still on the slide. But it gained a lot of traction, so we're quite well underway at the moment, and a lot of countries have signed up for doing this cross-cultural validation. Some of them are already done, and we see from abroad that the questionnaire works. So we now know for sure it works in Poland and Romania, but it also works in Macedonia, in Italy, in Turkey, in Israel, in Australia, in Russia. So I think we got gold in our hands. This is actually the Eastern Hemisphere, yeah, the Western Hemisphere with America. Well, we finally have Canada signed up last week, but the interest comes from the East. And of course, you will probably say, like, everything east of the Netherlands is the best. But it really works that way, and I'm very happy that we got all the 6 main languages of the European Union, of the United Nations now covered. So we got Russian, we got Chinese, we got Arabic, English, French from Quebec, and Spanish from Spain. So that means that we'll have all these working languages available. And, you know, overall, I'm very happy that we have come so far. And it's also a silent invitation to German partners. If we want to have a German one, it's easy to fix. Then a lot of people ask me, like, how good is this tool? Because in the Netherlands, everything was in the green, and a lot of people are satisfied. But this is like a little preview from Romania, from Bukarest. And you see, if you have no money in Romania, you're not happy at all. But if you are rich in Romania, you have probably a private gardener, a private nurse, a private driver. Your life is really good there, except for respect and social inclusion. I don't know why, but the average Romanian is not really satisfied with how things go. And it would be so lovely to have these data from Germany, to be honest, to see if they are more modest than the Dutch or more outspoken. I have no idea. So with all these data and all these cities, we have the city workers and the policymakers lined up. And what we're doing at this very moment is recruiting groups of older people that are going to try out what we call a so-called geoportal. And what is it? It's nothing but a smartphone where you take pictures, you upload these pictures with bits of text, and you categorize them in these 8 or 9 domains of WHO, and you upload them, because every photo you have comes with a GPS coordinate. Most people don't realize, but every photo you make is geotagged by our American friends, which is very easy for research purposes. But we are doing a lot of analysis. This is what you can see on that map, but I will touch upon that later. But we will actually combine geographical information from the city with the data from the questionnaires and the input from the photos. And what I really like doing was doing these co-creation workshops in 4 countries where we designed the interface for the mobile phone so that it's actually user-friendly and that people even with visual impairments can use it. So we did the focus groups or the design sessions in Romania and in Poland too. And we came up with a very user-friendly design where you can just write a small text. This is actually, I did a tryout in Australia, because Australia and Macedonia are joining in this effort as well. We had a big problem in Australia because of the coordinates. They had to be reversed because everything was upside down and didn't work. But you can just upload your photo. You will see where it gets taken. You can confirm it, so it's plotted on the map. And yeah, that's what we're doing at this very moment. And we hope to find the weak and the strong points of our city, and then we do everything on top of each other. But what people have not learned about is that we have a lot of data on our cities available through Google Maps or OpenStreetMaps. And we're also doing data harvesting at the moment. So what we're doing, we are looking at the distances to public transportation. So we know exactly, I'm standing here, there's a train station there, that's 100 meters. So I know for every address in my town of The Hague, how far it is to get a public transportation. This is one of those maps. And the municipality is a partner in this, and they're getting an upgrade as we speak in this month. So the company Object Vision makes this. But we have it for distance to a GP, distance to a hospital, to a nursing home, to the supermarket, to the library. We know all these data, and then we can superimpose the data in the end. And that's what we're going to take onto another session next round next year. We will do co-production with policymakers. So we sit together with all the people, with people from the town hall, and we're going to come up with our new action program for age-friendly The Hague and age-friendly Breslau, age-friendly Krakau, age-friendly Bukarest. And that's my final goal, to really have all the voices and the objective geographical data combined in order to come up with better policies, I would say, for all the people in these 4 cities, plus a city in Australia and a city in Macedonia. But when this all works out perfectly fine, I'd be very happy. But we still got over a year and a half to finish all of this. So if you want to know more about the project, you can always reach out to me. There is a website hosted in Romania, and all of the data is publicly available. And that leads me to the end. Thanks.
Danke, lieber Joost. Du kannst gern zu mir rüberkommen. Du kannst gerne hier an den Tisch kommen und dieses Mikro hier nehmen. Du kannst dich jetzt entscheiden, ob du deine Kopfhörer reinnimmst und dann hörst du, was ich auf Deutsch sage, und die Fragen aus dem Publikum dürfen auch gerne auf Deutsch gestellt werden. Du bekommst es simultan übersetzt. Genau. Kurz, um das nochmal abzubinden, es gibt in Deutschland 3 Städte, die dem WHO-Netzwerk Age-Friendly Cities mittlerweile beigetreten sind. Rade vom Wald jahrelang die einzige Stadt, eine kleinere Stadt. Mittlerweile sind im vergangenen Jahr auch Stuttgart und Münster, also 2 größere deutsche Städte, beigetreten. Wir haben ja von dir aber gerade gelernt, dass die WHO-Handlungsfelder zwar politische Maßnahmen vorschlagen, die man dann ergreifen kann und die zu mehr Altersfreundlichkeit führen soll, dass das Problem aber eigentlich jahrelang aus deiner Sicht darin bestand, dass niemand überprüft hat, ob diese Maßnahmen überhaupt zu den Ergebnissen führen, die man gerne hätte. Und da sitzt du an. So ungefähr die kurze Zusammenfassung. Gibt es aus dem Publikum Fragen an Professor Joost van Hoof? Gerne auch auf Deutsch. Frau Menke aus Münster.
Also die Broschüre gibt es auch auf Deutsch.
Diese Fragebögen, die wir gesehen haben, die gibt es nicht auf Deutsch. Was wir aber anbieten können, Joost hatte das gerade schon angekündigt, wir können die gerne auch weiterreichen und wir könnten auch eine Übersetzungsleistung liefern, wenn das gewünscht ist. Darüber hinaus können wir diesen Prozess aber nicht begleiten, aber das können wir gerne tun. Genau, weitere Fragen?
Is it working?
Ja.
Okay, because if we want to do the translation, I do have a professor who's a friend of mine from Fachhochschule Niederrhein in Mönchengladbach, and what we actually need is we can do the translation, we can do all the statistics, but we need 200 older people from Germany, preferably from one city, to fill out these 23 questions, because else we cannot do the statistics. And 200 is enough for validation. If a city says we want to have a representative survey, we probably need 200 no, 380 to 400 older people.
Okay.
And then you get a custom-made report for your own city, which is representative and can be used for political purposes.
Okay, also die Städte wären dann mit Joost van Hoof zusammen in der Pflicht, ihm 380 bis 400 ältere Menschen quasi deren Daten zu liefern. Dann könnte man den Prozess anstoßen, wie Joost das gerne vorhat. Gibt es weitere Fragen aus dem Publikum? Wir haben da hinten Frau Ulrike Krämer im roten Sakko. Das Mikro kommt hinter Ihnen und wird weitergereicht.
Alles klar. Ja, hallo, Ulrike Krämer, Generationsbotschafterin. I would like to know from what age on are you talking about aging people? And is that a criteria? Because I couldn't see that in the statistics. And the other thing was as well, I had the idea that Den Haag has quite a few rich people. How is this now changing worldwide? If you would see it now in 4 groups as clusters, is there a difference in the countries, and has it something to do with the aging longevity? Thank you.
That's a lot of questions in one question. So starting about these age cohorts. So our minimum age is 65, but even people retire at 67 now. Having said that, we do have the different cohorts, so 65 to 75, no, to 70, 70 to 75, 75 to 80 and above, and that was still done with an equal distribution of the local demographics, because every year on the 1st of January we get an update of the statistics on the city level in all cities in the Netherlands. So we always have quite real-time numbers on that. About the money, yes, The Hague is known for all of its fantastic expats and ambassadors and embassy personnel. So we do have quite a large number of very rich, and I would say also a large number of very poor. We have one of the richest neighborhoods is in the city, and the one that's actually the poorest in the country is also in The Hague. So it's very stratified. And overall, you see, because we now have the results in from 10 countries in total, that the money is the most important factor everywhere, but money in some countries gives you more than in others, because if you're a millionaire in Switzerland, well, you can just buy yourself an apartment. We have people from Switzerland here, I know. But if you have €1 million and you live in Turkey, you're really a millionaire, you know, and that makes a lot of difference, and that's why it's important to do these studies with a local team who can actually do the proper interpretation of what it means, and that's why we have to go through this cross-cultural validation, and we can't do it as a Dutch team alone. So we always work with local people, and then sometimes it's actually followed by a qualitative validation where we do interviews to understand why people have given certain answers. So it's always like double trouble. You have to do both.
Vielen Dank. Wir sind perfekt in der Zeit und wir nutzen die Gelegenheit, jetzt so langsam die Mittagspause anzukündigen. Vielen Dank, lieber Joost, dass du bei uns warst und weiter bist. Wir bleiben im Gespräch miteinander. Du hast die Zeit perfekt eingehalten. Vielen Dank.